First tonight on this World AIDS Day, communities around the world and here in Maine gathered for vigils, all to reflect on what has become one of the greatest public health challenges in the 21st century. The epidemic's impacts around the world are staggering. Since the start, the World Health Organization estimates more than 40 million people have died of HIV. The agency also says more than 38 million people worldwide are living with HIV last year, with regions in Africa remaining the most severely affected. Hey there, everyone. Thanks for being with us tonight. Here in Maine, there are about 50 new infections every year, and there's still no cure for the virus. News Center Maine's Alex Haskell has more from tonight's vigil in Portland.
Folks all across Maine wore red ribbons on Thursday to commemorate World AIDS Day, a time to remember and honor lives lost to HIV/AIDS.
I knew hundreds and hundreds of people, fabulous people, talented, brilliant people who died of AIDS.
Candle in hand, Deborah Shields braved the cold to attend a candlelight vigil in Portland's Monument Square.
I started doing AIDS-related work back in the late 90s when there was not a lot of hope.
A chance to reflect on the early days of the epidemic and the progress made.
Here we are now when there is a lot of hope and there is a lot of medicine.
Two things that would have changed Crystal Gamut's life.
I lost my mother and my father and my stepfather to AIDS.
They were among the hundreds of thousands of Americans to die with the virus. At the time, little was known and even said about HIV/AIDS because it was largely impacting the gay community.
We kept it a secret because the stigma was so extreme and so scary.
A reason seeing many gathered for a night of compassion and conversation is so meaningful.
I need that place where I can just talk about it and be together with other people and just see that we're not alone, because in the early years of the epidemic, we all were kind of on our own.
Years later, HIV/AIDS is not just easier to discuss, but also to treat.
I think the exciting thing now for HIV is that we can treat it with one pill once a day.
Dr. Stephen Rawlings is the medical director of Maine Health's Gilman Clinic. He says with today's medicine, people living with the virus can live long, healthy lives.
For the most part, it transitions to a disease kind of like I refer to diabetes. You know, just take your medicine every day, watch your health, and everything will be pretty normal.
An overwhelming sign of progress in a more than 40-year epidemic. But the fight is not over.
It's not just one group of people that needs to think about it or care about it. We all need to care about it and take care of each other.
And Bangor Health Equity Alliance also recognized World AIDS Day with its annual gathering. In Portland, Alex Haskell, News Center, Maine.
And today, Governor Janet Mills and the Maine CDC unveiled a new 5-year HIV prevention and care plan. The key goals of the new plan include improving early diagnosis, rapid treatment, preventing transmission, and rapid response to any outbreaks for free. Confidential HIV testing. Visit gettested.cdc.gov to find a testing location near you.